Welcome to your introduction to the Post-Birth Alert Orange Bracelet program. This video is designed to assist you in understanding and successfully implementing a post-birth alert program at your facility. My name is Danielle Wittig, and I serve as the perinatal quality nurse at FHN Hospital in Freeport, Illinois. Throughout this video, we will reach these three main objectives. For you to develop an understanding of what a post-birth alert orange bracelet program is. Second, how to successfully implement a post-birth alert program at your facility and in your community. And finally, how you will be able to access the tools and education you will need for your program. At FHN, the Post-Birth Alert team is comprised of a multidisciplinary team including leadership, staff nurses, and the Emergency Preparedness Coordinator who helps connect us to the community EMS providers. We have made it our mission to bring awareness to complications the postpartum patient is at highest risk for within 6 weeks of delivery to decrease morbidity and mortality in the community we serve. Our vision in the Post-Birth Alert team is to collaborate with community healthcare providers, EMS, emergency department staff, maternal health nurses, and patients to increase awareness due to complications of the postpartum period. As healthcare providers of any kind, we always like to know statistics so we can make sure that we are making the biggest difference. More than 2/3 of postpartum deaths were deemed to be moderately or substantially preventable per the CDC report in 2022. Also in 2022, the CDC reported that 817 deaths in the postpartum period occurred. While it does not seem like 817 birthing persons dying throughout the country is a staggering number, it is still a child without a parent and a partner without their loved one. This can affect you personally. If we can prevent even one death, we can touch a lot of lives who would be affected by that one loss. To identify patients who have delivered recently, each postpartum patient will receive an orange band before discharge that states post-birth alert. There have been discussion on whether to include patients who have experienced a demise, and it was determined the band should still be given and the patient is able to decide whether to wear it or not. The patient is then encouraged to wear the band for 6 weeks or as instructed by the provider at their follow-up appointment. It is also essential when educating the patient you involve the support system to ensure to alert the EMS or other emergency personnel of the date of delivery if they are requiring their services. Now that you have determined the patient is a postpartum patient, you can start to direct your assessment to whether the patient is experiencing a postpartum related complication. These are the 5 highest risk diagnoses for morbidity and mortality in the postpartum patient. If you see the band, you can start to gear your assessment toward these top 5 diagnoses. Target assessments related to these postpartum complications would include looking for preeclampsia and eclampsia, sepsis, perinatal depression, substance use disorder, cardiomyopathy, or venous thromboembolism. With the implementation of post-birth alert systems, the team is really hoping for the ability to collaborate with the ED staff when you are calling report. When the patient is known to be postpartum and having symptoms of the top 5 problems, the ED staff can then get into contact with the OB staff at the hospital and collaborate the care of this patient effectively. Communication and collaboration is key in saving lives. And if we can get this all done quicker, we are sure to have better outcomes for these patients. Assessing the patient while keeping in mind these high-risk diagnoses will assist in working through pathways for treatment of these patients, depending on the level of care that each department can provide, such as starting an IV for a patient who is exhibiting high blood pressure, so that can be treated as soon as possible when presenting to the emergency department. However, communicating the assessments to the hospital you will be taking the patient to will help to direct the care provided once the patient is in the emergency room. It is essential to have a collaborative team when caring for the postpartum patient. The main goal is to keep the patient safe and have OB staff come to the emergency room to assist in assessments prior to transporting the patient through the hospital to the labor and delivery department. We must keep the patient's safety and well-being at the front of our minds. Now let's spend some time on how to successfully implement a post-birth alert program. First, you want to develop a strong team. It is helpful if you have a multidisciplinary approach, including members from your emergency and discharging OB departments, including nurses and leadership, which will promote buy-in. And also think about having champions who work the floor available to help you with reminding nursing staff to hand out the orange bands to patients. The emergency department is essential to have involved, including any registration staff or whoever at your organization first sees the patients when they walk in from a personal vehicle and are not transported via EMS. Finally, having EMS personnel on the team will assist you in getting the education and knowledge of the post-birth alert program to the community healthcare providers. Next, you want to develop realistic goals and timelines in which you want to roll out the education to each entity and what forum you would like to use to educate everyone. At FHN, a member of the post-birth alert team was able to go to the emergency department staff meetings for one of the months to share the information and answer any questions. Since we serve a rural community, we use many team members to go out to many of our local EMS departments and give the education. The program has education created and available for use on our website. Information is shared about the program, recognition of the patients, and the 5 diagnoses that were mentioned on the assessment slide you saw previous. If you decide, like our team, to go out to individual departments to provide the education, keeping an Excel spreadsheet of dates each department had education will assist you in ensuring that each department was met. Make sure to set yourself a realistic go-live date. We were able to go live with our program 90 days from our first planning meeting. Through EMS, making this a part of their yearly as well as onboarding education will ensure this program will continue to sustain long into the future. Also think about that for any hospital personnel. Now your team can use the education and get out there and start spreading the word on how you are all going to collaborate to save lives. There are PowerPoints available on how to educate each of these teams. There is a specific OB postpartum nursing education PowerPoint, and this will instruct discharging nurses to educate the patient and the support persons on the A1 post-birth warning signs and place the band onto the patient at that time. This will ensure the patient does not receive another piece of paper at discharge. You are just supplementing what you already have. You will then use the voice over PowerPoint to educate emergency department and EMS personnel, ideally putting this on their yearly and onboarding education platform as previously mentioned. Ensure follow-up OB/GYN offices are aware of the program so they can assist in reminding the patient to wear the bracelets, as well as reinforce the importance of the band in case of an emergency. Ambulatory offices can also assist you in assessing for compliance of wearing the band and report back to you if they are noting any barriers the patient has. Also, think beyond healthcare providers. Reach out to your local health departments, WIC programs, any visiting nurses who see the patients for follow-up. The list is really endless. The more people who know about this program, the more likely it will be successful and seen as imperative to reducing maternal morbidity and mortality. The brochure you see here and all the PowerPoints mentioned are available for use and download to you. This allows for streamlined information to be shared. FHN will continue to make changes and updates as they come along, so please check back to our website to ensure you have the latest information to share. At FHN, we ordered the bracelets from wristbandbros.com. They allow you to customize the band. The color of the band is 021 orange, and the writing we chose was the bold black, although some go with red lettering that still ties in the same colors of the AWON post-birth warning sheet. Ensure the customization says post-birth alert as it shows in the photo to go along with the education that is provided. The band cost depends on the amount of bands that are ordered, but typically around 50 cents per band. Allow 3 to 4 weeks for customization, and be sure to order the 2 sizes that are available to ensure the patient who may have a higher BMI or increased swelling may comfortably wear the band. Once you know you're going to implement this program, get the bands ordered so you have them for your go-live date. Please note, the brochure is only to be given to healthcare personnel when they receive the training. This was not designed to be given to patients. The patients receive education utilizing AWON's post-birth warning signs, therefore have no additional papers at discharge. I want to give a special thank you to the creators of the Post-Birth Alert Orange Band, Jenny Wolf and Cindy Mitchell, who work at Advent Health Zephyrhills in Florida. Through networking and collaboration, the Post-Birth Alert program is possible. I also want to give a special thank you to the educational program that was created at FHN Hospital in Freeport, Illinois. Lynn Carter for being our leadership liaison, and our education partners, Michelle Allen, Alyssa Brunning, Robin Ortman, and Carrie Schubert. I know we covered a lot of information in this video, so for additional questions, please feel free to reach out to me for assistance with implementing a Post-Birth Alert Orange Bracelet program. Here is my email and my phone number. Please feel free to reach out for any questions.